Since the middle of March, much of America has been locked down. We're 3 weeks into the largest and most disruptive response to a national emergency in our lifetimes. And yet in the middle of that, you still often get the sense that our leaders are still feeling their way along, making up details ad hoc as they plod forward. And the mask directive today is a perfect example of that. Why? Well, they're waiting to receive the details of what to do next from the professionals they have gathered around them for directions. And it makes sense. Chief among the experts now crafting national policy is a 79-year-old physician from Brooklyn called Anthony Fauci. Fauci certainly has the credentials for the job. He graduated first in his class from Cornell Medical School. He spent more than half a century practicing medicine. He's been the director of the National Institute of Allergy and Infectious Diseases since 1984. For perspective, those of us who are 50 were freshmen in high school when he started there. So you can't say he's not experienced. He definitely is. We've interviewed Dr. Fauci respectfully on this program, and we gladly do that again if he came back, and we hope he will come back. He's an impressive person. But that does not mean that he's never wrong. On the question of this pandemic, Fauci has been wrong repeatedly. On January 21st, he appeared on television, for example, to reassure the public that the Wuhan coronavirus was not worth worrying about.
Bottom line, we don't have to worry about this one, right?
Well, obviously you need to take it seriously and do the kinds of things that the CDC and the Department of Homeland Security are doing. But this is not a major threat for the people in the United States, and this is not something that the citizens of the United States right now should be worried about.
It's not a major threat. So 2 days after he made the appearance you just saw, Chinese security forces quarantined an entire city of 11 million people. In some cases, they locked residents inside their homes from the outside. Some died there. Chinese authorities were clearly panicked by what was happening, but Anthony Fauci was not. He assured Americans that while they might want to reconsider immediate travel plans to Wuhan, going to the Super Bowl was absolutely fine. But as it turned out, it was not fine at all. Florida Governor Ron DeSantis now believes the Super Bowl in Miami may have been a breeding ground for the spread of the virus. But Fauci kept going, and he did it in public. On February 17th, when coronavirus cases were starting to appear all over the world, and it was a real concern, he once again reassured the American public that the danger in this country was just, quote, minuscule. He said people ought to worry more about the, quote, real and present danger of the annual flu than about coronavirus. Now, to be clear, we're not attacking Tony Fauci for getting it wrong on coronavirus. Most people did get it wrong, in and out of medicine. It's never easy predicting which faraway problems will become imminent crises here at home. Even the experts make big mistakes. They're human beings. They make human mistakes. And that's exactly the point that we ought to remember going forward. Human beings frequently underestimate risk, particularly risk on the horizon. Then they very often, in turn, overreact to risk once they identify it. And we may be watching that happen right now. Fewer than 2 months ago, Anthony Fauci told us not to worry about this epidemic. Now he's demanding that the federal government quarantine the entire country.
Does it make sense to you that some states are still not issuing stay-at-home orders? I mean, whether there should be a federally mandated directive for that or not, I guess that's more of a political question, but just scientifically, doesn't everybody have to be on the same page with this stuff?
Yeah. I think so, Anderson. I don't understand why that's not happening. As you said, the tension between federally mandated versus states' rights to do what they want is something I don't want to get into. But if you look at what's going on in this country, I just don't understand why we're not doing that. We really should be.
A nationally, federally mandated shutdown. So how long would such a shutdown last? Well, just 2 days ago, Anthony Fauci suggested the country should remain under quarantine until there are no more coronavirus infections and no more deaths. He did not suggest when that might be, if ever. But politicians followed his lead anyway. Virginia Governor Ralph Northam has shuttered his state until June 10th. A source with knowledge reports tonight that Andrew Cuomo has privately discussed locking down the state of New York until possibly fall. Meanwhile, various epidemiologists are talking about putting the entire nation on a year of cycled shutdowns. That means Americans would be allowed back to work, then ordered home again, then back to work over and over again. To be clear, these are extreme measures. We can only guess at the social and economic destruction they might wreak, but it would be profound, that's for sure. With this much at stake, it's important to know more about the science behind these proposed policies. So what is the science? It begins with sophisticated computer models that predict where and how quickly the virus will spread. The purpose of these predictions is to, as you've often heard, flatten the curve. Not necessarily to lower the death rate, we haven't been able to do that much, but to slow the spread of the pandemic over a longer period of time. Why? Because if everyone were to get sick at once, our healthcare system would collapse, and that would leave coronavirus patients and many other sick people without care, and that would be a disaster. So we're trying hard to prevent it, and we should. But it means these predictions really matter. How reliable have they been? Well, many government policymakers have relied on a model created by the Institute for Health Metrics and Evaluation, the IHME. By some measures, like death rates, that model has been fairly accurate. Yesterday, for example, the model predicted 1,036 deaths nationwide, and that turned out to be close to what happened. Today, it predicts about 1,200, and judging by the numbers right now, at 8:14 Eastern Time, that should be roughly accurate, too. But on other, likely more important numbers, these predictions have been terrible at best. As of yesterday, the IHME model predicted that the country would need 135,000 hospital beds just to treat coronavirus patients. That's what they said. New York alone, the model predicted, would need 56,000. That turned out to be not even close. Yesterday, New York was at about 13,400 coronavirus hospitalizations. That's not even a quarter of what the model predicted. And even that was closer than what the model foresaw in other states. For example, the model predicted Oklahoma would need 1,000 hospital beds. How many are they using now? 38. Louisiana was forecast to need 5,800 beds. Instead, yesterday, the state had about 1,600 hospitalizations, just a small fraction, and so on and so on. Nationwide, just 3 states had more hospitalizations than the model predicted. And in all 3 of those, they were small states with very small outbreaks so far. So why does this matter? Here's the problem with getting these numbers so horribly wrong. These numbers have driven massively disruptive government policy. Our entire national shutdown is based on the fear that coronavirus patients would overwhelm hospitals. And outside of parts of New York City, that has not happened. And we're glad for that. But we're concerned about what we've done to prevent it on the basis of models that have been wrong. So flip it on its head. What would have happened if the model had been accurate, if it had accurately predicted how many hospital beds we needed? If we'd known that, would we have quarantined the country? That's a good question. Unfortunately, it's too late now. More than 10 million Americans have already lost their jobs. Imagine another year of this. That would be national suicide. And yet that's what Anthony Fauci is suggesting, at least. Now, we're not suggesting Fauci wants to hurt America. We don't think he does. He seems like a very decent man. But Fauci is not an economist, or for that matter, someone who fears being unemployed himself. Like most of the people around him, this is not an attack, just an observation. Fauci has bulletproof job security. He's not thinking that way. He has the luxury of looking at the world through the narrow lens of his profession. He doesn't seem to think much outside that lens. Watch this exchange from NBC's morning show yesterday.
I know it's difficult, but we're having a lot of suffering, a lot of death. This is inconvenient from an economic and a personal standpoint, but we just have to do it.
Inconvenient? 10 million Americans out of work and staring at poverty. That is not, quote, inconvenient, as you just heard Dr. Fauci put it. It's horrifying. In fact, it's a far bigger disaster than the virus itself, by any measure. Tony Fauci, decent as he may be, can't see that because he doesn't think it's his job to see it. But even a doctor should be able to think beyond the models. Our response to coronavirus could turn this into a far poorer nation. Poor countries are unhealthy countries, always and everywhere. In poor countries, people die of treatable diseases. In poor countries, people are far more vulnerable to obscure viruses like the one we're fighting now. You want to keep Americans from dying before their time? Then don't impoverish them. For all his credentials, his experience, his apparent personal decency, Dr. Anthony Fauci does not seem to understand any of this, and we should never let someone like that run this country. Bret Baier is our chief political anchor and hosts Special Report every evening at 6. We're always glad to see him, particularly tonight, for some political perspective on all of this. Bret, thanks a lot for coming on. So,
sure, Tucker.
These underneath it all are essentially political questions. These are questions that are decided by people we elect, our politicians. And so what's the political backdrop behind the question of lockdowns? The president needs to decide whether to do a federal lockdown or not. Where do you think they're at on that right now?
Well, Tucker, I liked how you started, first of all, saying that Dr. Fauci is one of the world-renowned, most respected infectious disease experts in the world. And he and Deborah Birx have had the sway and the ear of President Trump from the beginning, and especially in recent weeks when his tone has